Good afternoon, everybody. It's a pleasure to be here. What this slide doesn't tell you is that I'm also a family carer. My son has a learning disability and autism. And during COVID, just like the 3/4 of the families surveyed by MenCap, my son's care needs have increased during the pandemic. Indeed, he's here with me today. And just like 3/4 of families surveyed, I am also worried about the longer term impacts of COVID on my son's mental health and well-being. During the pandemic, 2/3 of family members and carers said that their loved ones' support needs had increased during the pandemic. So it's in this context, and a context in which 1/3 of people also said that the funded care provided by social services had been reduced, that we're having this discussion today. So I thought it would be quite good if we started by listening to the voices of some people with learning disabilities themselves. And my son used to be a member of the Baked Bean Theatre Company, so he isn't today, but here are some people talking.
What is mental health? Who knows?
How you're coping.
Yeah, go into that a bit more. What do you mean by how you're coping?
Like if you're by yourself, your feelings and how you deal with other people.
Just try not to worry, just follow your own logical thinking.
There are approximately 1.5 million people with a learning disability in the UK, yet they're not being heard. 1 year on from the biggest change in our lifetime, actors at the Baked Bean Theatre Company have been exploring how people with learning disabilities have been impacted by COVID-19. Through a series of drama workshops run over the past 3 months, they have revealed deeply personal realities and a truly unique insight into their post-pandemic world.
So to think about the inequalities experienced ordinarily by people with learning disabilities and how they've been made worse during the pandemic, we just need to remember that there's a higher death rate in ordinary times, much higher during COVID, that key information is so often not presented accessibly, and it certainly hasn't been presented accessibly during COVID, that there's maybe very little time or experience of making reasonable adjustments within primary care, for example, with the COVID tests, vaccination admissions. I remember when I had my first COVID test kit, the 16-page, very difficult to follow guide on how to do it. And it led me to begin to create some accessible wordless versions of how to respond to the new world. And I'm going to introduce you to Books Beyond Words and the BW Story app, which I have founded and edit, and the charity is something that I chair. So sometimes clinicians we create our own barriers, and some of the barriers that are typical are that there may be fewer tests as a result of attitudinal problems, as a result of diagnostic overshadowing, when symptoms of ill health are attributed to a mental health or behavioural problem, or simply due to the person's own learning disability. And this actually leads to fewer tests and less treatment than other patients receive. And the consequences of this are that there's a much higher rate of premature mortality. In 2019, LEADER, National Mortality Review, found that people died on average 25 years earlier than the general population. And this was really important to think about when the decisions about who should be prioritised for vaccination were considered, Because when you realize that fewer than 2 in 5 people with learning disabilities live beyond 65 years of age, and then waiting until it's your age group's turn to be vaccinated didn't seem quite fair. And during the first wave, it was found that the overall death rate for people with learning disabilities was 8 times higher than the general population. And a new study in the BMJ shows that it was 36 times higher for people with Down syndrome. And in the first wave, something like 130% more people under the age of 30 died of COVID compared to their own age group. Oliver McGowan died because of poor care, and his mother has been a superb advocate to try to get mandatory training introduced. I've got a private members bill which I keep trying to get heard, which would certainly help to embed mandatory training. On their website, Oliver's parents ask that you understand the law. These are some of the laws that are important. That you put people at the heart of decision making, that you really respect them, and you don't make decisions without them. And very importantly, that you provide information and explanation in a way that they can understand. My work has always been inspired by my son, Nigel. When I first became a psychiatrist in learning disability, I used some of the techniques I'd used with him as a child growing up, in which I recognized his visual literacy, and yet to try to explain death to one of my patients, the death of his father, there were no resources available that recognized an inner emotional world in a man who had no speech. And so I created When Dad Died for him. Lots of people are more visually literate. Probably most of the people on this call are more visually literate, in fact. But we tend not to build on our visual literacy competencies. And so the work that I've been doing with the Beyond Words charity is to help you to have wordless resources available so that you can prompt your patient and understand their experience, simply asking open questions. What do you think is happening? How do you think the person in this story is feeling? And it helps you develop your own listening skills and your empathy, and indeed acts as a reasonable adjustment for many people. During COVID, I realized quite quickly that we were going to have to explain what was happening in pictures. And my son at the end of February last year had COVID. So we created Beating the Virus as our first story. But we've created something like 16 new stories. And of course, the guidance that goes with them has been translated to make them available internationally. These are some of the titles. And this is just a little example of the story in Beating the Virus. But there were a number of things to introduce, so the idea of wearing masks or gloves, washing hands, observing a suitable distance, a physical distance. There was a lot of guidance needed for staff as well, and we created guidance on how to address issues such as the increased risk of abuse at home. Everybody's being encouraged to stay at home. Sometimes it's not safe to stay at home. How do we deal with that? What would happen if Jack was to go into hospital with COVID and none of his carers were able to go with him? What preparation might we do in order to ensure that the right information goes with him, and that the people receiving him and caring for him know the importance of who he needs to talk to, and so on. Quite a bit about understanding death and dying. And the idea of the resources is to help to safeguard vulnerable people. These are some of the areas that we might cover and think about. We don't shy away from the difficult topics. This is not about superficiality. You may not have many words, but you still need to understand what's going on around you. And story is one of the best ways of helping people to understand what has happened to them, what is happening to other people, always in our stories with something healing happening at the end. And lessons to help recovery. At the beginning of lockdown, lots of people with learning disabilities were showing more behaviour that their carers experienced as challenging. Understanding why their regular routine was disturbed, having to learn new skills like how to engage on virtually, facing up to grief and loss. My son has had 3 friends whose mothers have died during this last year, experiencing illness and loss and worry. Okay, so learning new ways of engaging has been quite important. And small groups can learn and share and support each other, and we all know that. Most of us will have used Zoom or Skype or Facebook, FaceTime or something to engage, WhatsApp probably. We set up online book clubs to share wordless stories with people who, only those, of course, who had the technology, perhaps an iPad or other kind of tablet. So I want to hear now for another group of people with learning disabilities, and they're using online technology to share, and they're going to share about death and dying.
What's happening in this picture?
And it could be that the poor thing's got COVID.
It might be difficult because if she's by herself and she's scared, frightened, anxious, nervous, and if nobody's explaining to her, it's a very scary thing.
If it's COVID, if she's got COVID, then they're not going to be able to visit.
I think we just have to wait and see what's going to happen in the rest of the story. Before we
Yeah, I've put the next picture up, Amanda, so you can see what happens next.
She's asleep. She doesn't look very happy.
Amanda?
Yeah.
I'm wondering whether because I don't think she's alive. I think she's died. And you can see the drip. It's not connected to her. And the nurse is pulling up the sheet.
Yeah.
So I think she has died.
Clearly states to me that sadly the patient has died. You know,
yeah,
it's really upsetting to see. Really, it's amazing the emotional effects it can have on you. Really, it's you know, the power of the pictures. It's amazing, you know, how it can affect you. You know what I mean?
So that's quite powerful. And of course, talking about death and dying is something we all need to spend more time doing and thinking about. Well, I'm chairing a piece of work for the Department of Health looking at the way in which psychiatric hospitals are not meeting the needs of people with learning disabilities and autistic people. And it's 10 years since Winterbourne View. There's still over 2,000 people in inpatient beds. And the difficult conclusion from the work that I'm doing with people in long-term segregation is that this is not a therapeutic experience for them. They stay too long. And the main reason given is the sort of disconnect between health and social care and the financial disincentives and the failure of commissioning locally to develop the kinds of services that will prevent people being admitted in the first place. So this is a very brief introduction to the findings from my thematic review. My report should have been published yesterday and I was going to speak about it today. This is as much as I can say. I hope it will be published next week and that you'll look out for it. But things didn't get better during COVID. People's life stories were not known, their trauma was not addressed, community and hospital didn't work together, community services were just not available. We also looked at coronavirus in other secure settings and worked with the Royal College of GPs to develop a story with a voiceover from Michael Emmett, who's a former prisoner, and to help people within secure settings understand COVID. I'm going to finish by just introducing you a little bit more to the Beyond Words Story app, because it's something you can have on your phone, have it in your pocket, or put it up on, have access to the stories from within it, about 400 health stories on your computer in your surgery. And these are some of the subjects that are addressed. But it does mean, for example, that you can introduce subjects such as having a vaccination, having a blood test, attending a screening appointment, thinking about healthy living, and really trying to understand what the issues are that your patient might be facing at this moment in time, allowing them space to be able to tell you if they're worried about abuse in their lives and so on. And also, very importantly, making space for them to be able to talk about their grief when they've lost somebody, and thinking seriously about how some therapeutic help can be given to people who experience trauma. Remember, the majority of the people that I've looked at in hospital were people who'd had trauma in their lives, grief or abuse or some other trauma which had not been addressed in primary care. It can be, people do benefit from therapeutic interventions. And I'm going to end my talk here, but look forward to answering your questions. Please do ask lots of questions and lots of challenging questions for me. Thank you very much.